Hello everyone, I'm Dr. Tiara from Tiara Aesthetics, and I wanted to answer and address many questions that we get asked on a frequent basis about the non-surgical rhinoplasty or the nose filler procedure. Being our most popular procedure in 2020, we anticipate it going to be continuing into the coming few years as people's awareness about the procedure grows. So without the need for surgery, we can often address dips, depressions, bumps, asymmetries, and a drooping of the effect of the nose quite easily with some high density dermal filler and some special techniques. So let's get to it. What are the questions we get asked? So this is probably the most common question we get asked all the time, and as people are aware that we're using a filler to correct their nose, they assume that by filling the nose it will look bigger. So absolutely, if I was to fill the nose, I could straighten the nose, but it would look bigger. The way we avoid this is by using some clever techniques. So by using a really high density products, but using micro droplets carefully placed specifically to address certain areas of the nose, we can achieve a straightening of the nose without adding volume or filling the nose. So that's not the aim. The aim is to straighten the nose by keeping it looking as small as possible. And we do this using micro droplets. So no, it won't look bigger. So using needles, there's going to be a certain amount of discomfort, and often people describe it similar to having threading or plucking of certain hairs around the eyebrows or in the nose. Similarly, by using some topical numbing cream and the powerful anaesthetic within the filler, the nose will be numbed quite significantly, and most patients find it very, very comfortable to have done, and often surprising how little they feel. Using a reversible or a non-permanent hyaluronic acid filler, which is what we only use in our clinic, we can use an enzyme that breaks the filler down and gives the old nose straight back to the patient should they wish. It's one of the few procedures where we advise you to avoid wearing eyewear, such as sunglasses or glasses. So if your work's dependent on you looking at screens and you need this, then we advise you to take 3 days off. However, there's no specific need to take time off work as the swelling is very minimal and only really there for a few days. Candidate selection is really important for this procedure, and we like to assess every single nose and every single client's face and all the proportions and ratios beforehand. So virtually we like to assess and consult over email or over Instagram Messenger to assess the nose, the chin, the overall face shape, as well as then the key concerns that the patient or client has to address, and then to work out if they're a good candidate for this treatment or if they would be better off having surgery.